Thank you, Steny, and thank you for convening this hearing that should have taken place a long time ago. As we discussed the Affordable Care Act, I think it's important to remind ourselves what the situation was before the Affordable Care Act passed. Costs were going through the roof. Those with pre-existing conditions could not get insurance. Women were paying more than men. And every year, millions of people were losing their insurance. We passed the Affordable Care Act, and now the costs have continued to go up, but at the lowest rate in 50 years. Those with pre-existing conditions can buy insurance at the standard rate. Women aren't paying more than men, and instead of millions of people losing their insurance every year, 20 million more people have insurance. Now, the full name of the Affordable Care Act is the Patient Protection and Affordable Care Act, and we have patient protections, like your policy can't be canceled because the insurance company decides that they paid too much. With prevention and cancer screenings, no copays and deductibles. We're closing the donut hole. Those under 26 can stay on their parents' policies. We funded community health centers. We've made investments in education so that we can produce more doctors and nurses and other professionals. And during all that time, the Medicare trust fund solvency has been improved. Still, it's not perfect. But if we're going to make a change, we ought to improve the situation, not make it worse. Incredibly, every proposal the Republicans have come up with actually makes things worse, especially their replacement plan. Now, we know that CBO has confirmed what we already knew. Fewer people would be covered. Everybody else would pay more and get less. And rhetoric can't cure that problem. You can't fix it by saying that somebody who's paying $100 a month now, mandated to pay $100 a month now, is better off because the price went up to $1,000, but now they have the freedom to be uninsured. We have to recognize the program for what it is. Now, all the while you're inflicting pain on people, wealthy, the top 2% get massive tax cuts. And all of that is if the proposal works. The CBO talks about stability, and we have the commissioner from Washington State who will discuss what happened in Washington State when you tried to cover people with pre-existing conditions without universal coverage. Now, Mike Crowder, the Washington's 8th insurance commissioner, is a former member of Congress. We were elected together in 1993. He's been insurance commissioner since 2000. He was reelected to his 5th term last year. He's a doctor of optometry with a master's degree in public health from UCLA, and he practiced in group health cooperative in Olympia for 20 years. He also served 16 years in the state legislature, and he's a retired lieutenant colonel from the Army Reserves with 20 years of service. We'll hear, I guess, first from Doug Elmendorf, Dean of the John F. Kennedy School of Government at Harvard University. He served as the director of the CBO from January 2009 through March of 2015. Prior to joining CBO, he was at Brookings and director of the Hamilton Project. He previously served as an assistant professor at Harvard, principal analyst at CBO, and a senior economist at the White House's Council of Economic Advisors. We'll also have Andy Slavin, who is a former acting administrator at the Centers for Medicare and Medicaid. In addition to Medicare and Medicaid, his portfolio included the Children's Health Insurance Program and implementation of the Affordable Care Act by way of the marketplaces and healthcare.gov. Prior to joining CMS, he spent 20 years in the private sector, and so we're very delighted to have all of our speakers, and we'll start with Dr. Elmendorf.